Well, good morning. How's everybody? That's kind of weak. Come on. Good morning. How's everybody? That's what I want to hear from folks that are interested about healthcare, is a little enthusiasm and energy. Well, my name is Jeff Webster, and I'm the president and CEO of the Greater San Antonio Chamber of Commerce. We want to welcome you here today. Thank you for taking time out of your day to get here. I'm going to do a quick survey if I can. Was anybody on 1604 West besides me? Took me a half an hour to come from Heber to I-10. Traffic is crazy. So many of you I know probably came from the medical center area, but I appreciate you fighting the traffic and the congestion to be here and hear this important subject. You know, I've been blessed over the years. I served as a city councilman here in San Antonio many years ago as my friend here. And this is a subject that means something to this city and our business community. We have worked for years to try and address the concerns of how we address this both for our citizens, for our small businesses, to keep San Antonio healthy. And I'm really lucky in that my wife works in the industry, and I get to hear different facts that scare you, everything from diabetes in San Antonio, dementia in San Antonio, and these things that really start wreaking home that can ruin a community. Well, I've also been a business owner, and I've had a small business, and I was not able to provide health care for my employees at the time. Later in life, I began to realize what a threat that was to my employees and what a dangerous situation that was to place those employees in. So I think today you have an amazing opportunity to kind of get a grasp of some of the things that are going to happen in this community, what's affecting our small business owners, what's going to affect healthcare. But to really kick this off, you don't want to hear from me because I'm an uneducated idiot on this subject. So you need somebody that knows something. So I really feel lucky that we have the president and CEO of Methodist Healthcare, the system here. He took time to be a part of this because he knew this was important and he personally wanted to be here. So Dan Miller, would you come up here and present? Come on up. We're going to let you talk.
I couldn't tell if you were done.
I'm done. I just want to welcome you to the stage.
Perfect. Thank you.
Thank you, man.
All right. Good to see you. Thanks. Appreciate it. Well, good morning, everybody. It's great to be with y'all this morning, and if I hadn't had a chance to meet you yet, again, my name is Dan Miller. I have the honor of serving as the president for Methodist Healthcare, and I want to talk a little bit about why this issue is so important for our community and for the organization that I'm honored to lead. And I want to apologize. I am going to have to leave about halfway through the panels. Our finance committee of the board is meeting next door at our system office, and Greg Seiler, our CEO of Metropolitan, would be upset if I don't get his projects approved from the finance. So I apologize to just be with you for a bit today. Let me just kind of lay the backdrop a little bit for you. Today in Bexar County, 42% of every patient that's in a hospital bed today, this morning, is in a Methodist healthcare bed. We've got 11 hospitals, and one of the things I love about our system is we range from Fredericksburg down to Jerdington, to our newest hospital in Westover Hills, all the way up to Northeast Methodist on the 35 corridor, which just celebrated its 40th year anniversary yesterday. We have urban hospitals, like our downtown Metropolitan that Greg Seiler leads right there as the CEO, all the way to the largest pediatric hospital at Methodist Children's. And then, you know, they say everything's bigger in Texas, but nothing is bigger than Methodist Hospital. It's actually the largest hospital in the state of Texas, just surpassed Parkland and Houston Methodist for that honor. And so one of the things I love about our system is we see everything from downtown urban hospitals to rural hospitals to pediatric hospitals to quaternary facilities that are very few like Methodist Hospital in the United States. And then we serve community hospitals, great community hospitals like Stone Oak and Northeast Methodist. And so we have a really good handle on what it looks like when healthcare changes. And when I think about issues in the last 30 years since our partnership formed, a lot of the issues have been known. This is probably the greatest issue where I've seen a mismatch between awareness and the actual issue that's emerging. And we're going to talk about today from this incredible group of panelists who are going to tell you a little bit about what it means for our community context. When I think about Methodist Health System, and we also have our wonderful colleagues from University here today, and so good to see University. I was actually thinking about between University and Methodist, we see almost 70% of the charity care in the community. Now, Methodist, as you could expect, being the largest health system, sees the largest amount of charity, but University has a very high percentage of charity for the patients that they see, and we're very grateful for the work that you do and appreciate your partnership in serving the community. When I think about Methodist Healthcare, we see the most Medicare patients, most Medicaid patients, the most charity patients, and the most exchange patients, which we're going to talk about today. And so I greatly worry about the health of our community. There's 3.5 million Texans that use these plans. I'll just give you some headlines. It's about 15% of Texans, right? Which is a pretty significant number. And right now, those Texans get health insurance. In San Antonio, it's hundreds of thousands of folks. They get health insurance that has a tax credit that supports it. And they make sure those credits that they don't spend more than 8.5% of their household income in getting health insurance. And so what's at risk is when those credits expire at the end of the year, that what we're going to see is that cap goes away, and the credits that support those caps go away. So what it means for families, and we'll talk about that more today, is hundreds of dollars to thousands of dollars a month for families. And I don't know about you, but I don't see a lot of folks in our community that have that amount of just excess reserves every day. People are making hard choices already in the community to support the needs of their families. So I think what's at stake is a significant increase in the amount of patients, community members, many of whom are working in small businesses. And I want to thank all the business leaders here in the community, all the civic leaders here in the community. Thank the Chamber, Jeff, for adopting this as such a critical issue. Because what we know is when people don't have access to health care, they wait until they have emergent conditions. And then our colleagues at University and at Methodist, we see them in the ER, and we are honored and privileged to serve our community when they need us. But what it means is they're not getting access to routine care, preventative care, and we see a deterioration in health outcomes directly tied to access to care. It's logical. It makes sense. And so where this is going to impact our community the most is a lot of employees working for a lot of our small businesses, where the businesses themselves can't really afford to offer these healthcare plans, to their employers. And so I worry about the health of our businesses if our employees are unable to maintain their health status for those businesses and the important work that they do. I'll also share with you, it's hard to meet a growing community like we have in South Texas with investment, with the amount of uncertainty that we have. So our board recently just approved the largest investments in the history of our organization. So we're expanding. Yesterday we announced a $140 million expansion at our Northeast Methodist Hospital. Greg has should I steal your thunder, Greg, or not steal your thunder? No, I can't tell. Greg Seiler, by the way, a 13-year CEO of Metropolitan, one of the most amazing hospitals downtown. There used to be many adult hospitals downtown. There's 2 now. But our board just approved almost a $200 million investment in Metropolitan. And I just want to thank Greg for his leadership in shepherding that project through. This is a very difficult time to be reinvesting in these long-range, multi-million-dollar projects, particularly in an urban downtown hospital, with the fate of uncertainty ahead of us. And we also just approved a reinvestment at our Stone Oak facility, which will be over $100 million, as well. Our newest hospital, Westover, is already full. And so we actually need to reinvest and grow there as well. And we're looking at active projects around our med center facility too as well. So we're making these large, sizable reinvestments. And why? Because most hospitals are full in San Antonio. And our systems like University and Methodist need to continue to reinvest in capacity and meeting our community where they're growing. So we're making that investment in the face of uncertainty because it's what our community needs. We need to keep opening our doors and keep expanding as our community is. So the work that you're doing today to get educated and to listen to this issue will really help us continue to deliver care. And I'll finally just mention that many of you may be familiar with our organization and how we're structured. But I did want to just comment on who we are. So Methodist Healthcare is actually a joint venture between two owners. One of the owner is HCA, it's the largest health system in the country. And the other owner is the Methodist Healthcare Ministries. And if you don't know the Methodist Healthcare Ministries, if you'll permit me, the Methodist Healthcare Ministries has become a top 25 foundation in the United States whose sole focus is on the least served. So think about that. Our community in South Texas has a top 25 foundation whose sole mission is to create wellness for the communities of South Texas. They focus on the food bank, they focus on housing, education. We know that those elements within our community actually drive health outcomes way more than the care that we provide inside the four walls of the hospital. And so we are their sole funder at Methodist Healthcare. If we can't generate a return, then their mission ends there. And what you don't know about the ministry is they don't advertise, right? They're a foundation and nonprofit. They're not advertising that they are the largest contributor to the Texas Diaper Bank. They don't advertise that the building on Broadway that Aid the Silent just purchased was because of the ministry grant. They don't advertise. So I'm going to do it for them. But this conversation today is existential. It's existential for many hospitals, many rural hospitals throughout Texas, of which 10% of rural hospitals are facing closure across the state of Texas. And that's before this conversation. And so I want to close, invite Katie up, and just say I can't be more grateful for your advocacy, for your willingness to get educated on this issue. And I appreciate all you can do to help carry this message forward so we can reach those in decision-making capabilities to see if we can make a difference for our communities that we all serve together. So on behalf of Methodist Healthcare, God bless you and thank you very much. Katie?
Thank you, Dan. Appreciate you helping to set the table for our conversation. So we want to share more about what's at stake, what solutions are being offered, and then how all of us can urge lawmakers to try to extend these crucial tax credits before it's too late. Before we begin, we are going to watch a short video to help inform our conversation on enhanced premium tax credits.
Millions of Americans rely on enhanced premium tax credits to afford health coverage. In 2024, these tax credits helped 24 million people get coverage, keeping healthcare accessible for working families, small businesses, and more. But these tax credits will expire in 2025 unless Congress acts. If they're allowed to expire, millions of Americans will face a tough choice: pay much higher premiums or go uninsured. Without coverage, many will delay care until emergencies, leading to overcrowded ERs and higher costs for everyone. The economic impact will be severe. But we can stop this crisis. Congress must act now. Tell Congress to extend the enhanced premium tax credits.
Thank you. So now I'm very pleased to introduce today's panelists. Stephanie Ash is a strategic HR and legal operations leader with over 2 decades of experience. She currently oversees risk, benefits, and wellness at Spurs Sports and Entertainment. Dr. Debbie Jennings, is a clinical assistant professor here in San Antonio and chair of government affairs for Texas Nurses Association, District 8. Dr. Belinda Roman is an associate professor of economics at St. Mary's University and chief economist of Roman Economics, LLC, a nationally recognized economic forecaster. She specializes in regional economic impact analysis and serves in leadership roles with several national economic associations. Dr. Zeke Silva is an interventional radiologist with the South Texas Radiology Group and Vice Chief of Staff at Methodist Hospital, Texas. He serves as chair of the Texas Medical Association Council on Legislation. And Greg Hanch is Executive Director of the National Alliance of Mental Illness of Texas, NAMI Texas, a nonprofit organization dedicated to improving the lives of Texans affected by mental illness through education, support, and advocacy. He joined NAMI Texas in 2012 and has previously served in government affairs roles. Thank you all for joining us. So I think we'll start with a question for all of you to answer. We know the enhanced premium tax credits have helped over 3.5 million Texans, including more than 225,000 here in Bexar County. They are able to access more affordable health care coverage. So from where each of you sit, why is access to affordable health care such a critical issue right now? Stephanie, could we start with you?
Okay. Good afternoon, everyone. Thank you, Katie. From where I sit, this is a critical issue because part-time, contract, and gig workers are a large population of our workforce. For this group, the EPTC may be their only path to insurance. So expiration creates a case of access versus abandonment because it has the potential to impact the financial stability of families who rely on this affordable insurance. So for example, very quickly, a few months ago I was at a seminar and I was talking with a young lady who oversaw benefits for her organization. And she told me clearly, and I was a little bit surprised because she was a full-time employee, she says, you know, although I oversee benefits for my organization, I cannot afford the benefits through my organization. And so I rely on the marketplace to get my insurance because that's the way that it's affordable to me. So with these enhancements, I think that they're changing lives and they're important to stay permanent.
Thank you. Debbie.
I've been a nurse for 26 years, and I can see that there is a stark contrast between those who are able to have health insurance and those who do not have health insurance. And when we have tax credits and we have accessible insurance, it is often a safety net for many of those who cannot afford it. And what we see is with this on the chopping block, it is detrimental to the communities that we serve. And when you look at the #1 reason for bankruptcy in the United States is medical debt. And so now what we are doing is scaling back when populations, the majority of Americans cannot afford a $500 mishap in a medical debt. And now we are scaling that back. And affordable health care, I cannot say enough about it as far as what that is for a safety net for people to go on and produce effective lives, and we'll talk about that in a little bit.
Thank you. Belinda.
Good afternoon. Thank you very much for the opportunity to be here. So I'm an economist, so I'm always looking at things in terms of what are the economic impacts. San Antonio is driven by small business. And I would think somewhere around 90% of our businesses are small. So they're between 20 and 1 employee. And most of the revenues are around 500,000 or below. We're driven by small business, and if small business cannot afford health care, then the whole system, this whole idea and notion of San Antonio comes crashing down. And it's not just us, it's all the South Texas, it's all of Texas. So I think of it in terms of that, how do we keep us together, healthy, everybody working, everybody growing and going up? And I think this is the big threat for us, is that more holistic, and let's think about where we want to be in 5-10 years from now, and how we can manage this.
Thank you. Zeke.
Yeah. Thanks for the opportunity. Again, my name is Zeke Silva. I'm an interventional radiologist. I'm in the Methodist healthcare system. And it's such an honor for me to be a physician on a panel with this level of expertise, because what we see as physicians when we're taking care of patients every day is absolutely relevant. And when we think about a discussion like we're having today, where there's a risk of patients losing their healthcare coverage and potentially losing access, and I predict we'll talk about more concrete examples shortly. But when you think about just how diverse our city is, and you think about a practice like mine, where we're taking care of the entire spectrum of life, from expected moms to new babies to end of life, to really an entirely spectrum of disease, from acute disease and chronic disease and screening and wellness, et cetera. We'll talk more shortly about access, but as a physician, I just cannot overstate enough just how relevant it is that as many individuals in our population have healthcare insurance that's affordable, that they can maintain, in which they can be confident, so they can continue to pursue everything else that's important in their life, but primarily their own health and their own wellness. Thank you.
Thank you. Greg?
Yeah, thank you. I'm Greg Hanch with NAMI Texas. We're a statewide organization, and I will share that I think it's pretty well known, likely in the room, that Texas has the highest uninsured rate in the nation. We have the most number of people by volume uninsured in the entire nation. We don't need to make that problem worse by allowing these EPTC credits to expire. I represent the mental health community, and I wanted to share that there are 3 million Texans living with a mental health condition. That's 1 in 5 adults, 1 in 6 children. And despite the narratives that we may hear from the media, most of these people are just like you and me. These are our friends, our family, our neighbors, our colleagues. We may be working, side by side with them in an office environment. And people who get access to the right care tend to get better. They tend to be able to hold down a job. The vast majority of people who get the care that they need will experience recovery. But we have far too many people already in the state who are not getting the mental health care that they need. About 800,000 Texans in any given year are not able to access the mental health care that they need. And cost is one of the primary reasons for that. About half of those people who are unable to access the mental health care they need say that it's because of cost that they can't do so. When people get the care that they need, they get the medications, the therapy, the counseling, the support, they get better. But unfortunately, this issue will result in many additional people not getting the care and resources that they need to get better. And that's why we're here. We think it's so important that we ensure that people are able to keep their insurance coverage, continue to access coverage, and thereby be able to access mental health care.
Thank you. Let's hear from an employer perspective. Stephanie, in your role leading benefits and wellness at Spurs Sports and Entertainment, how have these tax credits helped your staff who may not be eligible for employer-sponsored coverage?
Sure. Excuse me. So we've already established it with the EPTCs in place. The marketplace offers affordable insurance. And so it's an alternative for employer-sponsored plans where we refer them out because they're ineligible for our plan. And they need insurance, they need benefits. I'm sure most employers, if you could, you would offer your part-time staff benefits, but it's just cost prohibitive for everyone, I'm sure, for most businesses. It's just not possible. The price to provide coverage, even for your full-time staff, is astronomical, and it's going up every year, and we all know that. That said, in my opinion, the EPT supports more than just access to insurance. It indirectly supports the workforce stability for those who are not eligible for benefits. Studies show very clearly that employee health has a significant impact on productivity. And I think in this way, the EPT credit, has helped most of us.
And would you anticipate that the loss of these tax credits would change how the Spurs approach HR concerns, particularly for those employees who rely on marketplace coverage?
I would say that most large organizations will have to change how they approach all of these areas because employers are going to be looked to solve these gaps that employees are going to be facing. And also, I think we also as employers are going to have to deal with the indirect consequences of employees not having insurance. So losing coverage could absolutely mean higher absenteeism, lower retention because employees are going to seek out higher paying jobs with benefits, and also lower morale and productivity because these problems don't stay home. Whether you have health issues or you're stressed about finances or all those things, they make their way into the workplace. So I think as an employer, large or small, you're going to have to consider this as an impact.
Thank you. Zeke, as a practicing physician and hospital leader, can you tell us how the expiration of these tax credits could affect patient access to care and hospital operations like Methodist?
Yeah, thank you. It's such an important question, and I want to build on the comments that were just made, because one of the nice things about being a physician is you get to think about what your patients are experiencing, what their circumstances are. When we think about sort of the enhanced tax credits or enhanced premium tax credits, sort of the way I think about it is when you're deciding what your health insurance is going to be, many of us have employer-sponsored insurance, but in circumstances where that's just not the reality, it is the marketplace where a huge number of our citizens are going to, where they currently go, but continue to go for their insurance. And the way I think about it is, you look at sort of the benchmark silver plan, and it's for a family or for an individual, it is a very personal, very deep financial decision. Is are you willing to pay this much money to have insurance coverage? What we're talking about here is the ability to get, and it's an oversimplification, but sort of a coupon, if you will, from the government saying, we really want you insured. We have a program, the American Recovery Act, that expires at the end of this year to help you achieve that coverage for all the right reasons. Those coupons are going away, which is why we're having this discussion today and why we're sort of so concerned about it, number one, but number two, why this is almost a call to action. But in answer to Katie's question, we see it all the time at the clinical level. And think about yourself, and if you've ever had kind of a health scare, where you're in a circumstance where something's just not right with you or your family, well, what do? You go to your doctor, you go reach out to your physician. If it's really a dire circumstance, you go to the ER. But now imagine that same circumstance where you're in that position, but you don't have insurance. For whatever reason, whether it's financial, you just change jobs, your circumstance dictates, and then you delay that care because you're concerned. It's going to be costly to go. You're going to have to take off of work. I mean, there's very real economic, financial reasons why that might be delayed. And in answer to the question, what we see, and I'm a diagnostic and interventional radiologist, is I see cases all the time where you look at the CAT scan or you look at the diagnostic imaging, and you think to yourself, like, why wasn't this caught earlier? Why did they wait to come? And maybe they're just really strong and tough and they can take a lot of pain, but maybe it was an economic, financial decision. And now we're in a circumstance where the only place they can go is the emergency room, because the emergency room, for all the right reasons, has to take care of that person. Now the disease is more complicated. Now the recovery is more prolonged. Now the hospitalization is longer, and regrettably, oftentimes, the outcome is different than what it could have been with an earlier diagnosis. And a foundational part of that discussion is the simple aspect of having affordable insurance coverage among our citizens. Thank you.
I definitely want to make sure that everyone is taking away that folks are making decisions to delay coverage or delay treatment because they lack affordable coverage. So thank you. Melinda, can you tell us, as an economist, what the expiration of these tax credits mean for local businesses and overall economic activity here?
There it is. Okay, thank you. Well, I mean, it's a double-edged sword. Okay, the first part of it is losing the support of government through subsidies or whatever it might be means the businesses have to take on more responsibility, and that's a challenge to the bottom line, which then becomes a decision of, do I continue to hire or have these employees, or do I switch them to part-time, or how do I adjust, or do I insert technology? And it becomes a very complex and difficult decision because the other side of it is the humanity part of it. You want to have loyal, working employees because they develop the relationships out with your customer base as well. So it means more than just losing the dollars. It means a bigger picture, and that's what I see is going to be a significant issue for us here, and statewide. We're not looking at that big picture that we need to understand about how we relate with each other and to each other.
And in your research, are you seeing that there are some sectors of our community or state that might see the impact first?
Well, if you look at the data on businesses, and especially small business, they all tend to be in healthcare, actually. There are quite a few small health-related programs in businesses, let's say. So here we are talking about health and health outcomes, and we're talking physicians and hospitals, but what about all the ancillary care? And them not being able to stay in business. That just compounds what's already happening. So whatever the numbers are right now, and then we're looking at them here, they're probably going to be much bigger than we even think. And the impact more enduring if we don't address now.
Thank you. Debbie, you're helping to train our future healthcare workforce. How might the expiration of these tax credits affect not just the patients, but also the stability and well-being of those providing the care?
Yeah, so the expiration of the tax credits will have a ripple effect. And, in the public health world, we talk about upstream, downstream impact, right? Where what happens upstream directly impacts you downstream. We have the opportunity today to have an upstream impact by addressing the expiration of these credits. By us saying, we are going to do everything we can to put processes in place, to back legislative, we are going to have that impact. What we see is we have, it's already been talked about, we have patients that are coming into the hospital that are going to be sicker. They're delaying, preventative care. They're delaying what they need. I was telling Katie that a few years ago, I started signing people up for the Affordable Care Insurance because I got really frustrated with people signing them up for plans that just didn't make sense. And I wanted to learn how to do it. And I cannot tell you the conversations that I've had with people as we've made these connections and what this is doing for not only the wellness of their family, the wellness of their children, the wellness of their business, and to be able to really have that impact on connecting people with affordable health care. This is really crucial when we look at an already strained workforce. I have nursing students who depend on these tax credits to go to school because you have to have health insurance in order to be in nursing school. And so they are not often able to afford some of the higher premiums that are out there, so they rely on this. And when we say that education is a trajectory to a better life, but yet we somehow cripple people from a health insurance perspective, I can't make those two right in my head. So.
Well, we're lucky to have someone so engaged in our community. Thank you for your leadership. But I would like a little bit to drill down a little bit more. Maybe you could talk to us about certain segments of the workforce that are contract or part-time and the impact that this might have on them.
Absolutely. So if you are lucky to work in the healthcare system or any job, right, where you work full-time and you're offered full-time benefits, but there's a lot of nurses that work contract. There's a lot of nurses that work part-time, and they want to do this so they have flexibility to be with their families. And, when we saw this really impact people, especially we saw this with DACA students that we had with nurses that are in the community. When we have nurses that are not able to show up and provide, they are not even able to afford their own health insurance, and they are providing health care in the hospital to these patients. And so this is really just a huge issue when you talk about what this does to the small business, to the workforce, to the people that are taking care. I pulled these numbers because I wanted to make sure that I had them for you, but there's a lot of stress in the workforce right now with nurses. And we see a lot of nurses that are transitory, that are working part-time, and they are working contract nursing. And it is projected in the state of Texas that we are going to swell to a severe nursing shortage. We are expecting 57,000 by 2032, which is detrimental. And when we look at not urban, but rural areas and what that looks like from just affordable health insurance for everyone who's providing care for them.
Thank you. Greg, how do these tax credits impact access to mental health care here in Texas? And what could losing them mean from people managing mental illness?
Yeah, that's a great question. I mean, I would say it's already challenging enough for people to access mental health care for various reasons. One of those is pervasive stigma around mental health conditions. You know, you might also call it discrimination. You know, people have to overcome these societal perceptions around mental illness that tells them that, you know, it's a weakness to have a mental health condition, or there's a shame associated with a mental health condition, when it's actually so many of us who live with it. But these negative viewpoints around mental illness have been reinforced for so long. So we have to overcome that challenge, and that's part of the work that we do. And then once you get there and you get people to a point to say it's time to seek help, they're juggling a lot of other things in their lives that it makes it hard for them to make their mental health a priority. You know, they might be dealing with childcare, they're trying to pay their mortgage, they're going to school, they have a job to hold down. So, you know, of all of these other, and they might have other co-occurring health conditions on top of all this, mental health often doesn't rise to the surface of what people prioritize. But again, when you get them to that point, and hopefully they haven't reached the point of needing emergency care by that point, and many of them unfortunately do and enter the emergency care system before they receive any form of preventative community-based care. Then you have the reality that there aren't enough mental health providers to meet the demand for services, and especially in a state like Texas, where we have the most severe mental health workforce shortages in America. So, people have to search long and hard to find access to mental health services. And unfortunately, there's this sort of two ends of the spectrum where people with means are, much more likely to be able to find a private, psychiatrist, counselor, than people on the lower end of the economic spectrum. That portion of the population, you have safety net services, which have their challenges. Community mental health centers that largely serve the uninsured, people on Medicaid. That system has gotten a lot better, but there's still a lot of work to be done there. And then you have the people in the middle, and I think that's kind of the people that we're here to talk about. The people who might have a part-time job, they might be self-employed, and they, will, if they're able to get insurance through perhaps these EPTCs, they have a much better chance at being able to access care. Not that the insurance environment is perfect. I think Dr. Silva and I know that very well through our work at the state capitol, that there are improvements that need to be made to the insurance system itself. But it is what we have to work with. And the opportunity here is to make it affordable for people. And I'll just tell a quick story of someone that we have in our network who had trouble getting a diagnosis, and before she got to that point, she was too ill to work a regular schedule. And through her marketplace coverage that was made possible by EPTC, she was able to get the initial diagnosis, experience a dramatic recovery. She had reached a point where she was desperate for access to care, and she was likely a risk of harm to herself. But she got a diagnosis at the right time, she got care at the right time, and that was all made possible through the insurance coverage that she was able to afford because of EPTC. So I would just summarize by saying, without EPTC, she probably would have lost her job. She wouldn't have been able to have that part-time job. She would have likely gone uninsured and forced to rely on the safety net for regular care. She would have been at significant risk of needing emergency care, and she might have needed to be hospitalized, which a lot of those services are paid for via taxpayer dollars. she may have lost her life if she hadn't gotten access to the care at the very right moment. It was a sort of a bang situation where any longer without access to the right care may have been a dramatically negative thing. So, you know, that I think story sort of speaks for itself, that EPTC, for the people that we serve and many others, can be a life-changing reality for them. Life-saving reality is what I mean to say. And it also protects, it helps us address the global societal burden of these disorders, in that it doesn't just improve the quality of life for the individual, it also helps employers by keeping people in the workforce. It helps us reduce our expenditures on emergency care. You know, depression is the leading cause of disability worldwide. So we have an opportunity to reduce that massive global economic burden, which is in the trillions of dollars, by simply providing access to coverage and thereby providing access to care. It's a very powerful thing and a great opportunity for us.
Thank you for sharing that story. I see some folks want to comment. Zeke or Belinda?
I'll be quick, because Greg made an interesting, a very relevant point sort of regarding legislative activity. So in the state of Texas, by the Constitution, the only bill that the legislature has to pass is the budget. Everything else is sort of optional, proverbially, if you will. We were in the Capitol dealing with a whole lot of these insurance issues, but there's an interesting dynamic that's taking place. Is what we're talking about here is largely at the federal level. You know, it's HR 1, the big beautiful bill. We'll have that discussion shortly. But as the budgetary process is and was taking place at the state level, it's done. I mean, unless the governor calls a special session, the state budget, as we speak, is set. And the governor will sign this into law by the 22nd. So you have this circumstance where we're describing challenges coming from the federal government, from a budgetary for our community, with the state really having no ability at this point to address it directly. And it really creates an important open question is how we're going to take action to protect the citizens in our state with this difficult circumstance. Thank you.
Belinda, did you have something?
Yes, I wanted to go back because you make an interesting point about health insurance. I've been doing research in diabetes and workforce participation because that's a very big issue for us. And some of the commentary from some of the providers that I'm working with, mostly on the east side, south side, west side, is it's not just insurance. Those premiums are actually not affordable. And because the premiums aren't affordable, they delay care. Another reason to delay care. Another reason not to follow through with care and adherence. And so we have these outcomes that are so challenging to the system, and Methodist and other hospitals then have to do the charity care, right? They have to do the uncompensated care. And it's just a crazy situation that doesn't make sense. So whatever the solution is for the insurance, it also has to address what the out-of-pocket is, the copays, and whatever our premiums are going to be and everything else. Otherwise, it's not going to be a solution. And as you say, the budget's set, and it's every 2 years, so that falls back on us, and it falls back on the cities and the counties to be creative with the dollars they're having. And we know already that there's an issue there because the tax situation, the hollowing out of central of the cities and moving to the suburbs, it's a very complicated question. But I think that if we are in agreement that it's something that needs to be done and we want to address it, then we will and
Yes.
find solutions.
Yes.
Right?
I mean, clearly there's not just one lever that we pull to magically fix everything, but it is reassuring that this is a piece of that solution. So thank you. Thank you. So let's do another question for all of you. And this is something that I always ask when I moderate is, one, is there a takeaway message that you want to make sure that the audience leaves with? Or was there a question that I have not asked you yet and you want to make sure that you get a chance to say it? Any of you are welcome to start.
So I'm glad to start. There's sort of a point here that's so obvious that it's almost easy to overlook, and that this is kind of a secret. I was in the state capitol for 3-4 months working with lawmakers at the state level, and no one's talking about this. And you go to DC, and I know many of you go to advocate in DC, and they're talking about it, but they're not talking about the granular level that we're talking about it. which from my perspective means that this is an incredible, incredible opportunity for us collectively to get this message out there. And it is foundational, it is educational, it is an opportunity to just say, this is the problem, this is what it is, this is what it means. Because until you have that understanding, that shared understanding, it's hard to move towards taking steps from an advocacy perspective to solve the problem. But that first step is very much in our wheelhouse. And I think it's a tremendous opportunity. Anyone that has relationships with your local lawmakers or relationships in DC, I mean, the leadership in this room is outstanding, so it gives us sort of that proverbial megaphone to make those statements. But if there ever was a time to make it, it is now.
Thank you. Yes, I fear there is a disconnect between policymakers and what the problem really is. Linda?
I mean, the other piece is what we're doing here with the chamber, which is, you know, the business, the collaboration between everyone to find a solution, because we know it's going to be increasingly difficult to get it from higher levels of government, because a lot of that is being pushed down to the lower levels now, right? So we're going to have to think creatively. And look, there's some very interesting things happening in San Antonio. When I watch like the Gonzaga group, or I watch Kano, and I'm thinking, gosh, what are they doing, and how are they actually serving, and how can those models actually scale up to meet Methodist or one or the other? You know, how can they scale up, or how can we scale down and find solutions that way? Because there's some very creative things going on. We're going to have to innovate our way out of this, is what it is. Yeah.
This is a community of problem solvers. Greg?
Yeah, you know, I mean, I think we get to the point in panel discussions like this where everyone is so positive in support of, you know, extending the EPTC. You're wondering, like, well, this seems just like common sense. You know, what would be the rationale for not doing this? And I think, you know, there are some likely sort of counter arguments that we might come across. And among those is simply, well, isn't the price tag too high? You know, aren't we concerned about federal spending? And, you know, I think it's just important to remind ourselves of the fact that, you know, the EPTCs are critical for the business community, and they're critical for governments in sustaining tax revenue for local services, local infrastructure. And also to make sure that we keep our tax-paying citizens healthy and employed. You know, I saw a number in my talking points here that I wanted to just make sure we really underscore, and just imagine the impact of this happening in your community. If these tax credits expire, 69,000 jobs in Texas will be lost. That's a lot of people becoming unemployed. And I worry about the economic impact of that, but I also worry about the effect that has on people's psyche, which is, I think, often something that goes overlooked in the conversation about employment, unemployment figures, that work is important for people to feel a sense of purpose and to be contributing to something bigger than themselves. And so that's a lot of people who have now been, if this happens, will now be put out of work, and our economy will suffer as a result of that, but also people's psyches and mental well-being will suffer as a result of becoming unemployed.
Thank you. Either of you want to add anything?
I would love to. We live in a state that does not have Medicaid expansion. And when we look at affordable health insurance, being there to be a stopgap, to be that safety net that I mentioned earlier, the minimum income for you to be qualified for the Affordable Care Insurance is $15,600. That is minimum. So my question to you all, it's not really a comment. When you think about who that captures, when you're thinking about low income, marginalized populations, the ones who are actually using the healthcare system at a much greater and more expensive rate because they can't afford that upstream aspect. So my question, Do you know anyone out there who can afford a $500 bill from a medical debt that does not disrupt food, electricity, gas, doing what they need to do to get to work? Because these are the decisions that people are having to make. Do I pay for my medication, or do I pay my electrical bill? These are the conversations. And so when we take it down to a granular level, it's really the people who are most impacted by this are the ones that need the healthcare system the most.
Any last words, Stephanie?
I think my panelists here, they've all made amazing points, and you're driving home the thing that stuck out to me, which is this is really about consequence beyond policy. It's not about the complexity of policy, it really is about the consequences, and this is a humanity issue now. It's bigger than anything else. I mean, I think everything that's been contributed here, we can see how there's a trickling effect, and the consequences are something that we would have to live with. So I hope that we will all stand together and do our best to fight against the expiration, or at least our city doing something about it.
Thank you, well said. So I do have more questions that I could ask all of you, but I don't want to miss an opportunity for the audience to talk to you and engage with you. So we're going to open it up to the audience. And if you don't mind, just trying to speak clearly and loudly so we can hear you up here. One.
I have a question. So there's 3.4 million people in Texas that are benefiting from these tax credits. I think in Bexar County it's 225,000 residents. Why aren't we hearing more about this issue, either in the community or in the business community? And what can we do about it collectively?
And I think that's a really good question. And the thing that pops out to me is that there was a misconception that these were permanent. I think there was just a lack of knowledge. And at this point, education is needed. I don't think people realized when they enrolled that, okay, I'm enrolling now. They just thought I just have affordable insurance. They didn't realize it would go away.
Yeah, that's it. The other important point about that is if people aren't aware now, kind of when are they going to realize it? Like, what's that point in time where they just go, oh my gosh, something's changed? Well, the enrollment period is around October. So if you think about what the solution is, it's sort of two, is maybe HR 1, the reconciliation bill, maybe the Senate comes in and they throw these funds back in, or the conference committee does. That would be the ideal solution, at least extend them for a period of time. But let's assume that doesn't happen. Let's assume there's not another bill, reconciliation bill coming in the fall. Well, around September, October, the health plans start to file their rates. They have to file those with the state, or at least if they're arrested, they have to file them with the appropriate regulating bodies. And then the notices, if you will, go out to our citizens, and they'll see 75% increase. And to the excellent points made earlier, those dollars are real for them. So then the point becomes, well, then do they drop the insurance? Do they stay in the marketplace? Do they look elsewhere? That's when sort of the proverbial uncertainty comes, and it'd be great if we could address this before that becomes reality, but I'm not sure that we will. We'll see.
There's a lot competing for our attention, and a lot of news, a lot of different things, and I think that's part of it, because who wants to talk about health insurance, right? So, but we need to. It's one of those conversations that we need to, and I think that's part of the issue. We gotta, whether it goes through social media or some other outlet, it needs to be a conversation that we have with each other about, how are you feeling, how are you doing it, and do you have health care? Does your job provide health care? Very simple questions, just, casual conversations that probably we have already, but we don't realize what we're actually saying to each other. But, it's a competition for ideas and being noticed, and I think that's where there's a challenge.
I just want to say really quick that I appreciate Juan bringing this to my attention. I think over a year ago, I teach health economics to graduate students, and he actually came in to check out one of the lectures, and he asked me about this afterwards, and I'm embarrassed to admit, I didn't realize that they were expiring. And, to Stephanie's point and to the panelist's point, I think they're here to stay. Why would they expire? This is necessary. And so I'm really grateful for the chance to have this conversation. And Juan's been like Paul Revere out there, like, they're expiring. So thank you. I appreciate that.
For those of you who interact regularly with policymakers, do you have any tips or suggestions about what you think is the most effective way for us to talk with lawmakers about this issue?
I always think there's tremendous value in stories, and that sounds kind of trite when you hear someone say that, but I've always found it effective to go into an office, very quickly. They're busy people. If you get with their lead staff or the lawmaker themselves, they've got so many issues going on that their time for you, not even their attention span, just their ability to listen to what you're saying is limited. So I always just sort of come in and very, very quickly say, Senator, here's the circumstance, here's the problem, here's how we think we can fix it. And I gotta tell you, I had a patient just last week that came into my office with a condition that clearly could have been treated earlier with better insurance. And I'm worried that she's not gonna have access to that going forward in her family. And when they see that personal side, and if you're really purposeful, you make it one of their constituents and they really can relate. And then once you can kind of make it personal and you have their attention, you have their ears, then you very quickly have to pivot to the solution, which is, in this case, extending those these premium tax benefits going forward beyond 2025 into 26 at least.
And just quickly, I would just add to that by saying, for those of you who are in the business community, I think it can be an effective way at getting a legislator's attention to talk about the difficult situation that your business may be in already, the operating costs, the challenges of sustaining the business, the people that you employ who rely on your business for their livelihood, and the economic impact that would result to your business from Congress not taking the necessary action. I think that argument tends to resonate with many elected officials.
Oh, the question back there?
Good afternoon. My name is Abigail Moore, and I represent the field of substance use disorder, similar to Greg. We know with the opioid crisis and just the risk of substance use disorders, this will impact people's recovery, access to treatment, and it's much needed. So if I hear you correctly, because we do a lot of advocacy work as well, the state and the federal level, does this expire? So next year, when people do their income tax, they will not be able to have that credit. But this December or this time of the year, they can. They can still cover it, or is it ending for this coming year? You know how people do their income tax, usually
Right.
first of the year, January, March, April, around there. Are you saying that that credit will not exist then?
And someone may know better than I, but please correct me. When they go to enroll in health insurance in 2026 through the marketplace, they would not have essentially the coupon, as Dr. Silva put it, the coupon to help them afford that coverage.
Wow, okay.
And thank you for your work in the substance use disorder community.
And that's something our association, the Association of Addiction Professionals across the state, can definitely, I was ignorant of this expiry. We have insurance coverage for our full-time staff, but this is not something I monitor, but it is for our clients and the people that we serve. So I will definitely bring it up to our association and support any, letters, legislation, whatever we can do to support in our field as well.
Well, let me just make sure that everyone in the audience knows that there should be a QR code on a little card next to your plate, and you can scan that, and that will help you communicate with Congress. The messaging is already creating. You can also connect with us in the Good Government Group ambassadors. You may have seen the logo at the end of the video. And if there are other materials that you want to access to help with your audience, your network, I hope that you'll ask us for that help, because your voice definitely matters. Any other questions? Yes.
Hello, my name is value of storytelling and what that does for our local lawmakers and small business owners and self-employed. I think that our self-employed unit in San Antonio does a wonderful job advocating for themselves when they're aware of the issues. My question is, what current communications plans or storytelling efforts do you have to get this information out to our small businesses and self-employed sectors?
It's an all hands on deck effort at this point. I'm a big believer in associations in general. So for me, Texas Medical Association, American Medical Association, this is front and center. The challenge is there's so much uncertainty around HR 1 and what the Senate's going to do with that bill. You'd like to think in a perfect universe they'll just extend it and we can all just take a deep sigh. The bigger challenge for me is what's going to happen if HR 1 doesn't extend it, then a bill comes in later and does extend it, and now you've got the rates are set, and now you have to go to retroactively to reestablish those rates. And so to your question, the stories are going to change, and they're going to change chronologically depending on what happens in Washington. But there's so much leadership in this room, including the chamber. I think we all need to be doing everything we can, either on our personal interfaces with social media, as associations, to get this out to the greatest degree possible.
Well, staying connected with us will help you get the most current updates and the most relevant communication.
Exactly, because, I would assume then that from the top down, let's say the Hispanic Chamber of Commerce, the U.S. Chamber of Commerce, all the way down, this should be a concerted effort. So understanding where you can plug yourself into that and help propagate the story and the needs. So, take somebody, I'm not a media person, but somebody who understands those strategies will hopefully be able to help. Or you already started it, right?
Mm-hmm. Yes, thank you. Go ahead, Greg.
And I would just add that it's worthwhile connecting with your healthcare advocacy community. I think the business community is clearly engaged on this issue, and the healthcare advocacy community is as well. And so there are some great organizations out there. Some of them are disease specific, like mine, NAMI. But you also have coverage advocacy organizations like Cover Texas Now. Research the organizations in the healthcare space that are already working on this issue and plug into their efforts. Many of them have developed communications toolkits, things like that you can sort of copy paste what has already been produced on this.
Perfect. Juan.
And if you scan the QR code to the right, that'll be a opportunity to join a coalition focused on this issue. And you'll get up-to-date messaging and updates on the tax credits. That can be used to communicate out to your contacts as well.
The one on the left is the coalition one, and the one on the right is to directly take action and contact your members of Congress. Thanks, Paula.
Please join me in thanking the panelists for sharing their insights and experience. Your voice definitely matters. We thank you all for being here today, and enjoy the rest of your afternoon.